Hey guys, what's up? So I'm trying something new. I want us to start something new. I'm beginning the NCLEX question and answer review. I used to do this. I stopped doing this for a while. Been busy. I want to come back for it. We'll start doing it, and let's see how we go. Okay. So I'll try my best to see what I do. Try to post 2 videos in a week. And like I said in my previous video, how to prepare for NCLEX, always start with the simple topics. You've been out of school for a while, and to get back to reviewing materials is not that easy. Reading needs some sacrifice, and you have to make time for that. Start watching some videos, get yourself acquainted, and see how it goes. So let's get started. Today, we're going to see some 5 questions under ethical and legal issues in nursing on the context of the NCLEX-RN. Let's get going. Part 1, question number 1. Let's go. Yes, you have this. A client is brought to the emergency department by the Emergency Medical Services, EMS, after being hit by a car. The name of the client is unknown. The client has sustained a severe head injury and multiple fractures and is unconscious. An emergency craniotomy is required regarding the informed consent for the surgical procedure. Which is the best action? A, obtain a court order for the surgical procedure. B, ask the EMS team to sign the informed consent. C, transport the victim to the operating room for surgery. D, call the police to identify the client and locate the family. In NCLEX, where you are reviewing, I advise you to spend 1 hour 30 minutes per question. Which option do you think is the right answer? C is the right answer. Transport the victim to the operating room for surgery. Let's make a review of this question. Let's break it down, okay? In informed consent, there are 2 situations in which client consent is not needed. For an adult, okay? Adult here, we're talking someone above 18 years. 1, in emergency situation where obtaining consent might delay and result to injury, might delay treatment resulting to injury, like in this present situation. 2, if the client waives the right of informed consent, the client says, this is somebody, we are going to see in the next question, who can sign the consent for me in case I'm incompetent, in case I'm not capable, okay? These are the options. Let's look at why A is not right. A will delay emergency treatment. Yes. B is inappropriate. It's not even right. D can be somehow right, but it's not the best action because it will still delay the necessary emergency treatment. Let's look a little bit at the informed consent again. What is the nurse's role during informed consent? Your role as a nurse is to obtain the consent. And when you are obtaining the consent, what do? You want to be sure that the patient is cognitive and is able to voluntarily give consent. Okay? You're also there to make sure that the signature of the patient is authentic. It's actually the patient who signs. 3 important points I've said here. Let's look at the healthcare provider. What is the healthcare provider's role during informed consent? He or she is the one who educates, and before you obtain consent, you must make sure that the patient or the client has been educated by the healthcare provider about the procedure to be done, okay? So he explains the advantages and disadvantages, the alternative treatment, the prognosis, so that the patient is ready to take informed decision. Okay? Now, let me give you some other important point. What happened in minors? We're talking about adults. We know that in minors, the parents or the guardian gives consent. But in NCLEX, there are situations where these minors can give consent by themselves. You might have seen questions like that. Example, when treatment relates to substance abuse, drug abuse, you don't need the parent consent or guardian. If it's a minor below 18, you just go ahead and do it. Psychiatry treatment. The client, the minor, wants to obtain psychiatric treatment, the parent cannot stop. The minor is pregnant, something that has to do with birth control services. The minor has HIV/AIDS and wants to take treatment, the parent cannot stop. The minor is an emancipated minor. What do you mean? The minor has been declared to be an adult, even at that age. Maybe the minor is in the military, or the minor is married and is living out alone and capable of taking his or her responsibility. You might have seen the word emancipated, emancipation in English question. That is the meaning of it. In that case, you just go ahead, the minor has the right to give consent. Okay? Okay, that is that for that question. Let's see question 2. Question number 2. Okay. It says, the nurse who works on the night shift enters the medication room and finds a co-worker with a tourniquet wrapped around the upper arm. The co-worker is about to insert a needle attached to a syringe containing a clear liquid into the antecubital area. Which is the most appropriate action by the nurse? Oh my God. Have you ever experienced this? A, say call security. B, call the police. C, call the nursing supervisor. D, lock the co-worker in the medication room until help is obtained. Which is the right answer? C, call the nursing supervisor. That is the right thing to do in this situation. Let us explain. This has to do with what we call the Nursing Practice Act. You have to know the Nursing Practice Act and the Board of Nursing Regulation and Policies of your state. Okay, so the Nursing Practice Act requires that you have to report impaired nurses, nursing like drug addict and so on, you have to report. So the Board of Nursing has jurisdiction over the practice of nursing and developing plans for treatment and supervision of impaired nursing. So in this case, what would you do? You report to your supervisor. Your supervisor is the one in charge to then report to the nursing board, and appropriate investigation and action can then be taken. In this case, there is no need to call security, no need to call the police and so on. There's no need for that. Okay. Now, just to give you a little hint, then Board of Nursing determines the patient to nurse ratio and the number of hours. If your facility is going against this, you have the right to report the facility, the nursing board. But there is procedure for that. You have to make sure you have concrete evidence, and you have to understand the policy of the facility. Sometimes when you sign your contract, maybe the workload and so on, they can go a little bit out of this, but if it's something that is repeating over and over and over, and your facility or your supervisor has been called to order and they are not taking action, you have the right to report to the Board of Nursing. Okay? So that is that. Let's move to the next question. Okay, question number 3. Question number 3 says, a hospitalized client tells the nurse that an instructional directive is being prepared and that the lawyer will be bringing the document to the hospital today for witness signatures. The client asks the nurse for assistance in obtaining a witness to the will. Which is the most appropriate response to the client? Number 1, A, I will sign as a witness to your signature. B, you will need to find a witness on your own. C, whoever is available at the time will sign as a witness for you. D, I will call the nursing supervisor to seek assistance regarding your request. Which is the right option? D is the right option. That is the right thing for you to do. Let's revise. What is this area talking is talking about? You are reviewing for NCLEX. I do know in most parts, like for international nurses, we don't have advanced directives in our country here where people have to write their will. Some people have their will, like some other will, not actually medical will. But in the US, it's common, and it wants you to know this is very, very important. And this is called advanced directives. So what is it? It provides information on the care the patient wants when the patient becomes unable to provide, to give consent or to give instruction or directive. So whenever the patient comes on admission, you have to find out if they have this document. And there are two types. One, we have the living will. The living will is what we call the instructional directive. And what does it contain? The living will lists out the medications to be given. Whether the patient, when the patient is not able to say anything or to take any action, you can give me oxygen, you can do resuscitation or not. So this document spells out all of this. The second one is called durable power of attorney for healthcare, for the healthcare. What does this mean? This document appoints the person who can take action when this client is not able to do anything, and it is called a healthcare proxy. And whosoever that the patient assigns or appoints become the sole decision maker whenever this patient is not able during towards the end of life. Even the wife, the kids, if you are not the one, only the person. The person can be the wife, it can be the son, it can be an attorney, whosoever. At that point, only you takes decision. Okay. Now, what you do as a nurse, your responsibility during admission, you find out, do you have this document? If the patient says, I don't have, you find out if the patient wants it, and then you inform the healthcare provider who comes and discuss with the patient and comes out with this document. It is your responsibility to know if this patient has a living will, the DNR, or not. Okay, I'm going to say that. So many states prohibit the healthcare provider or the nurse or anybody taking care of this patient to be a witness. Okay, but know the regulation of your state. Now, in this living will, what are the choices? What are the things that are mentioned on it, the provisions? Like I said before, it indicates if I cannot take decision, you might give me IV fluid or feeding tube. You might do resuscitation or intubation. You might give me antibiotic or not. You might leave me to die naturally or not. So it spells out all of this, okay? So it would also have this DNR, what means do not resuscitate, okay? So that you know if the patient is dying, cannot breathe, if you should do CPR or not. Is very, very important, unless you will lose your, your license. You're just working for 2 weeks and then you lost your license. That was that. Let's go. Question 4. Yes. Question 4 says, nursing staff members are sitting in the lounge and taking their morning break. An assistive personnel tells the group that she thinks that the unit secretary has AIDS and proceed to tell the nursing staff that the secretary probably contracted the disease from her husband, who is supposedly a drug addict. The registered nurse should inform the AP that making this accusation has violated which legal tort. Yes, some of you who talk, baby, you don't even know your work ethics. That's why this question is under ethics. You don't just talk. You don't just talk. So let's see. A say a label. You call it libel or label. B, slander. C, assault. D, negligence. Which is the right answer? B, slander. This is a slander. Slander is part of a deformation of character. You say false information to ruin somebody's reputation. This is not correct. You can do this either by a written document. People just send some email to the boss talking nonsense about a colleague. In that case, it's called a libel. And if it is verbal, it's called slander. Okay? An assault occurs when a person puts another person in fear of a harmful or offensive contact. Let me take it again. An assault occurs when a person puts another person in fear of a harmful or offensive contact. Negligence involves failure to provide basic needs that anyone with these professional skills in normal senses would have provided. Either intentional or unintentional is negligence. Let's look at another one for your information, malpractice. Malpractice is a type of negligence, okay? And this is what? Violation of duty or failure to provide care that results in injury. Now, you might have come across some questions that say there are certain points and certain items and things that must be involved for one to say there was a malpractice. One, there must be a duty. It means you have the obligation to provide duty to this client. Two, breach of duty. You did not provide the duty the way you are supposed to in relation to your scope of practice. Three, there's a cause. What is the cause? The cause is failure, the breach of duty. And four, there is harm. This breach of duty results to harm or damage. These 4 points must be involved for one to say there was a malpractice. Did you hear that? I will round up this question by giving you a lot of examples of negligence. There are some questions, it might come in multiple choice questions for you to select which of the options, the sentences describe negligence. Medication errors that result in injury to a client is negligence. IV administration errors such as incorrect flow rates that result in injury to the client, infiltration, phlebitis, falls, that everything is put in place to make sure that you prevent fall. If the patient falls, it was due to negligence. Failure to use a safety technique. Failure to check your equipment to make sure that they are properly functioning. Failure to report critical vital signs to the healthcare provider. Yes, it's negligence. Allowing a child to use drugs or alcohol is negligence. Allowing a child in an environment that is dangerous, that can cause potential harm to the child is negligence. Failure to show affection. It might sound funny. These are all instances of negligence. Let's go to the last question and round up for today. Question number 5. And what's that? Is a select all that apply question. Which identifies accurate nursing documentation notations? Select all that apply. It's a SETA question. A, the client slept through the night. B, Abdominal wound dressing is dry and intact without drainage. C. The client seemed angry when awakened for vital sign measurement. D. The client appears to become anxious when it is time for respiratory treatments. E. The client left lower medial leg wound is 3 centimeters in length. What do we know? Let's revise. What do we know about nursing documentation? It's very important. It's part of your nursing care. Part of what you do, you document all the time, either by handwritten or by typing or whatsoever you document. And you must know the features of nursing documentation. It will save you a lot. It will help even after how many years they can still go back to it to refer to make sure that everything was documented. Remember, failure to document means action was not taken, care was not provided. It's point blank, no argument. So, nursing, which are the right answers? Let's do that first. A, B, and E are correct. The client slept through the night, abdominal wound dressing, the client's left lower medial leg wound is 3 centimeters. These are the right options. Let's see why C and D are not the right option. First of all, when you write a notation and you use words like seems, like angry, like you don't use your words. You don't use phrases that vague entries, vague words. You must be specific. You must be objective. You must be descriptive in what you write. Objective data and subjective data. Objective data is what you see, what you hear, what you smell, what you know. Subjective is what the patient tells you. Let's see, for example, objective, the skin color, temperature, productive cough, wounds. You can see that it's draining or not. Subjective data, I slept through the night. That is the patient telling you. Write it in the patient's words. I have a headache. I feel dizzy. It's the patient telling you. Write this down as it is. Okay? It must be complete, accurate, and timely. So let's look at some common errors in nursing documentation, which I have listed so many of them. Do not write on your personal opinions. Omissions, you omit a lot of points. Vague entries like seems and seems appears, late entries, inappropriate corrections, very important. You write down something and you think it's wrong, draw a straight line on it so that, and then put your initials. One should be able to read what you have written. Don't take your pen and then you put that, or you take a marker. No, you don't do that. Okay? Unauthorized entries. Vague abbreviations. I will come out with some questions on which abbreviations are accepted in nursing for the NCLEX purpose. Illegible writing and lack of clarity. Some of you whose handwriting is like the file is crashing something on the floor. Learn to write well. So guys, I'm rounding up this session with this question. If you think it's helpful, let me know which topics you want me to prepare on. Let me know if I'm fast. Let me know if I'm slow. Let me know if these additional tips I'm giving, they do help. Like if you watch this, you can be able to answer other questions just by listening to this, because I have touched other areas which you might find questions on the same topics, right? Let me know if this idea is good, or you want me to just read the question, give the answer, and then brief rationale, and then move to the next, or you like the idea that I'm able to say any other things relating to that question. So guys, let me know what you think about it. Listen to this, put your earpiece, you're doing some work, listen to it over and over, share with your friends, and subscribe to the channel. I will be bringing in more questions and answers and discussion. Thank you very much, and see you in my next video.